Shall we start? Are there any more to join?
I think we can start. Some students are joining with one device in the hostel.
Okay. That's okay. That's okay. Um, so I thought of doing this session because now we have newly introduced a session on uh, how to train you all to give basic life support in pediatrics. Like, so we are going to have the first session hopefully tomorrow. As far as we can get the skills room open by the other staff if they hopefully come tomorrow. So this session is to just to to tell you what are the things that are going to happen, and just to give you some knowledge in preparation for that session, right? So we are going to train how to give basic life support, and how to approach foreign body aspiration, which is again a life threatening event. What things can be done in such a situation in terms of providing resuscitation to a child. So let me open my presentation. Can you see these slides?
Not yet, sir.
Not yet. Can you see now?
We can't see the screen, sir.
You can't see, right? So let me share. Still you can't see, right?
No, sir.
Not yet. You can see, right? Okay. So the objectives of this lecture is to understand the structured approach to basic life support, and then to learn the sequence of basic life support, and then to describe the skills that you need to acquire in order to perform basic life support. So this is providing basic life support has no age limit. It essentially include anyone start age from 1 month up to those who are up to 18 years. So there is no age range as such for giving basic life support. So as you all know, the priority would be to follow airway, breathing, and circulation. Because if you don't restore airway or breathing, then you cannot restore circulation. So first of all, you have to correct airway, then only you can correct breathing. And if you have corrected both airway and breathing, then only you can correct circulation. Otherwise, you can't correct the subsequent component. So in practice, so basic life support happens usually in a out of hospital setting. This may be by the side of the road. This may be at a bus stop, or this may be in ambulance where you may not have all the resuscitation drugs or ventilator. So basic life support essentially means that you are prolonging the life of the patient or life of the child uh, until you arrive at a place where you can perform advanced life support. But then, because this place is not a hospital setting, you have to be careful before you touch the patient, because the child is unconscious or child is arrested because the child was exposed to an electric current. So if you touch the child, then you will also become a victim. Therefore, the first thing in a BLS setting is to make sure that you are safe and you are not exposed to any dangers, right? So the first thing in a BLS setting would be to look for any dangers, right? And the second step would be to assess the responsiveness of the child. So you can, call the child uh, and then see whether the child is opening his eyes, or whether the child is moving one of his limbs, or whether a child is making one of some sounds, to see whether the child is responsive. And the next step would be, because now you are most likely to be the first person to see such a child, the next step would be to uh, call others for help, who will be able to provide you support in providing the basic life support. So the ground rules, first is to look for any dangers and make sure you are safe. And the second is to assess the responsiveness of the child. So all children who are needing basic life support will not be responsive. So assess for the responsiveness. And then if you at the time you find the child is not responsive, then you have to shout for help. And then once you have ruled out dangers and make sure that child is not responsive and called for help, the first step is to uh, keep the airway patent, or to apply the airway opening maneuvers. So in NLS also, you probably learned how to open up the airway of a neonate, right? So in neonates, you have to keep the face parallel to the ceiling, right? We tend we tend to not to do the head tilt, right? Here also, because we don't know exactly whether the child was exposed to some kind of an accident, and therefore having a high risk of sustaining a cervical spine injury. Therefore, we do not need to perform the head tilt step, but you can do the chin lift. So in these three photographs, what is shown is the maneuver to perform chin lift. So we can do this tomorrow, but this is just to give you some knowledge about what we are going to do tomorrow. So in performing the chin lift maneuver, so you have to keep one hand at the mandible or at the chin, and the other hand at the forehead, as shown in the photographs, and then lift the chin. So that will, if the child's tongue has fallen back, then that will kind of correct the anatomy by doing the chin lift maneuver. And then the next step of airway opening is to apply jaw thrust. Again, jaw thrust is applied with both of your hands at the border of the mandible, so that your all the second to fifth fingers lie on the border of the mandible, and you lift the mandible, without pressing on the soft tissue structures at the neck. Again, you are trying to open up the airway. So first of all, now so far, if you encounter a child in a place where you cannot perform and then make sure the child is not, child really needs basic life support, child is not responsive, and then shout for help, and then apply airway opening maneuvers. So airway opening maneuvers will be done first as the chin lift and second as the jaw thrust. And the next step, now here you may not find oropharyngeal airways in such a setting. So after that, after these two maneuvers, you have to do the standard, follow the standard technique of assessing for breathing in the form of look, listen, and feel. So here, this lady is performing this look, listen, feel technique to assess for the presence of breathing. So if you find no breathing at this point, then you can give 2 rescue breaths through 2 rescue breaths. So here you don't need to give inflation breaths because his lungs are inflated already, but you can give 2 rescue breaths in the form of 2 ventilation breaths, right? So if you don't find an ambu bag, these breaths can be delivered as mouth-to-mouth breathing or mouth-to-nose breathing. But if you find an ambu bag with a face mask, then you can deliver as a bag and mask ventilation. So you can give 2 rescue breaths. And after that, you have to see whether there is breathing in the form of look, listen, and feel, right? And if you do not detect breathing at this point, then you have to go back and correct the airway. So again, you have to make sure that you have applied chin lift properly, you have applied jaw thrust properly. You can look at the oral cavity, look for any foreign bodies, right? And then you have to go back to the airway and correct the airway, and then come back to breathing and reassess by look, listen, feel for presence of breathing. And in these 2 photographs, the top photograph shows how to keep the face mask or how to keep your mouth. So the face mask should cover the 2 nostrils and the mouth. However, it should not go beyond the chin, and it should not press on the eyeballs. So you have to select an appropriate size face mask while providing rescue breaths. And if you find there is breathing after you correct airway and give 2 rescue breaths, then you have to move to assess for circulation. Now, in these photographs, this shows how to assess the circulation. If the child is an infant, then you can feel for the brachial pulse. That is what is recommended. Or if the child is old, then you can go for the carotid pulse. So feel for the carotid pulse or feel for the brachial pulse and assess for the circulation. And you can take no more than 10 seconds to assess the circulation, because the child is likely to have been in a circulatory arrest. And if there are no signs of circulation, then you can start CPR. So CPR is delivered in basic life support as 15 compressions per 2 rescue breaths. Now in newborn life support, I hope you can remember the breaths to cardiac compression ratio is 3:1. And in basic life support, cardiac compression to breaths ratio, rescue breaths ratio is 15:2. And the heart rate or the cardiac compression rate should be kept at 100 times per minute. Right? So we'll recall the sequelae again. So you look for dangers and then assess for the responsiveness and then call for help. So make sure that you have stick to these 3 ground rules and then apply for opening airway opening maneuvers and then give 2 rescue breaths. And once the breathing is there, then start CPR, give cardiac compressions at a rate of 15 per 2 rescue breaths, and do it at a rate of 100 cardiac compressions per minute. And the 2 images show how you can deliver cardiac compressions for an infant or a smaller child. If you are the sole person looking after the child or giving basic life support, then you can use the two finger technique, two finger technique. And if you have another help available to give rescue breaths, then you can use the encircling methods to deliver chest compressions. And for an older child, you can use one of these 2 techniques, so one-handed technique or the 2 hands technique. Whatever you use, you have to press about 1/3 of the diameter of the chest, and you have to press the lower half of the sternum, right? But the rates remain the same, 100 chest compressions per minute, and at a ratio of 15 chest compressions per 2 rescue breaths. So yes, so you have to provide CPR at a rate of 15 per 2 for all children, and compression rate in all ages 100 per minute, right? So we will recall once again, because this is the one that we are going to practice over and over again tomorrow. So first assess for the responsiveness. First assess for the dangers and make sure that you are safe, and then assess for the responsiveness. So after making sure the child is not responsive and there is no signs of life, then you have to immediately call for help and then open the airway in the form of chin lift and jaw thrust. And then if there is, then assess for the breathing by look, listen, feel, and give breathing either mouth to mouth or using a face mask and a amber bag. And you can deliver 2 rescue breaths and reassess with look, listen, feel. And if there is effective breathing, then go on to perform cardiopulmonary resuscitation, start chest compressions at a 15 per 2 ventilation breaths ratio, and go at a rate of 100 chest compressions per minute. And we don't find defibrillators here, but if in the Europe or in UK or Australia, you will find defibrillators by the roadside. So this is considered as part of giving basic life support. So if you have access to a defibrillator, then you can try delivering shock to a child signs of circulation. So you have to continue CPR until the child is responsive or child shows a normal breathing pattern. And once the child has established breathing and circulation with basic life support, then you can lie the patient in the recovery position. Right. So this is one component of providing basic life support. And the next will be the approach to the choking child. That will be the second scenario. So choking child is a child who has aspirated something. It may be any kind of a foreign body. It can be a coin, or it can be a piece of vegetable, or it can be anything that has blocked the airway. So when you have a blockage of the airway, then obviously that can potentially result in cardiorespiratory arrest. because of the hypoxia and activation of the vasovagal response. So in this scenario, you have to assess the child. First, see whether the child is having cough or not, whether the child is coughing or not. So a coughing child is likely to be conscious, right? And they're likely to have suffered least damage, right? So if the child is having effective cough, then you can encourage coughing. And then the child himself or herself will be able to expel the foreign body out. And then support and assess continuously. And the other scenario is the child who does not have an ineffective cough. And there can be two possibilities for a child who does not have an ineffective cough. One, the child may be conscious, but is at risk of losing consciousness in the next minute. And the other child is who is unconscious, right? So if the child is conscious but have no effective cough, then you have to deliver back blows and chest thrusts. So these are delivered sequentially. So we will, I will demonstrate to you tomorrow how to deliver these back blows and how to deliver the chest thrust. So, but before that, you have to make sure the child is having ineffective cough and child still is conscious, right? And then you can deliver back 5 back blows first. And then if there is no foreign body coming out, then turn the child and deliver 5 chest thrust. So as far as child remain conscious, but no foreign body can be seen coming out, repeat this sequence, giving 5 back blows and 5 chest thrusts. Again, 5 chest thrusts, and so on. So assess, reassess, and repeat. So in here, a child may, body and remain conscious, right? So then you can continue to provide support to the child and keep the child in the recovery position. Is your back blows and chest thrust may not be successful in pulling out the foreign body, so that the child may lost consciousness as well. So then you have to follow the basic life support arm for these children who remain unconscious. So then you can try initially airway opening maneuvers, inspect oral cavity, and then make sure the child's airway is patent by the form of chin lift and jaw thrust, and then perform 2 rescue breaths, and then continue with CPR as we discussed before. And as far as the child remain unconscious, then you have to repeat this sequentially. And if the child becomes conscious, then you have to go to the other arm and then start delivering back blows and chest thrust. And if the child develops effective cough, then you have to encourage cough. So this is the pathway that you can follow in an out of hospital setting for a child who has ingested a foreign, who has aspirated a foreign body. So again, to recap what we have discussed, this, a child with choking child in a out of hospital setting. Again, make sure that you are safe, rule out any dangers, and then assess for the responsiveness, and then call for help, and see whether the child is having effective cough or not. And if there is effective cough, encourage coughing, and then support and assess continuously until the child makes a full recovery. And if the child is having ineffective cough, assess whether the child is conscious or not. If the child is conscious, then deliver 5 back blows followed by 5 until the child cough out the foreign body. And if the child becomes unconscious, then follow the basic life support pathway, practice opening airway maneuvers, start giving 2 rescue breaths, and start also delivering chest compressions at a rate of 15 per 2. right? In managing a choking child, there are two things that you have to avoid. One thing is finger sweep. So finger sweep is not recommended because it can make the foreign body that is lodging within the oral cavity to pass into the airway, like deep into the airway, causing further blockage of the airway. Because you don't have other oral airway adjuncts or other facilities to take them out in an out of hospital setting, finger sweep is harmful. And also Heimlich maneuver. Now, we discussed that we can deliver back blows and chest thrusts. Heimlich maneuver is a way of delivering abdominal thrust, which was practiced a few decades ago. But because it's ineffective as well as it can damage the intra-abdominal organs, Heimlich maneuver is not recommended in children, right? So the good things are to inspect under direct vision and to deliver the back blows and chest thrusts, right? So these two photographs show how to deliver back blows and how to deliver the chest thrust. So you have to hold the child as shown in this image. So you have to support the child's chest with one hand and tilt the head slightly downwards so that the child, it's comfortable for the child to cough out, and then deliver back blows 1, 2, 3, 4, 5. And then if there is no foreign body can be seen coming out, then you have to turn the child to the other side and use one hand to support the back of the child and support and and then using the two fingers apply um, chest thrust and deliver 5 chest thrust. And then still if there is no foreign body, repeat these two sequences successively, right? So that is what we are going to practice tomorrow. Uh, if you can hopefully do that session with other staffs attending, right? So to recap again, in any basic life support scenario, make sure that you are not exposed to dangers. So look and actively rule out dangers and assess responsiveness. Look for any sounds or any eye opening or any movements, right? And then immediately shout for help, and then start correcting the airway, practice chin lift, and practice jaw thrust, and then assess for breathing by look, listen, feel. And if there is no breathing, then give 2 rescue breaths and reassess for breathing with an assistant. And then once the breathing is established, provide assess for circulation, taking not less than 10 seconds, CPR at 15 to 2 and at 100 compressions per minute. And if there is a defibrillator available, then you can deliver shocks the child with no signs of life. And you have to continue this sequence of cardiopulmonary resuscitation until the child becomes responsive or until the child demonstrates a normal breathing pattern. And the choking child, again, you have to make sure there are no dangers, assess for responsiveness and call for help, and then assess whether the child has got an effective cough. If there is an effective cough, encourage coughing and then continue to offer support. If there is no effective cough, assess whether the child is conscious or unconscious. If the child is conscious, then deliver 5 back blows and chest thrust and continue to repeat these 2 sequences until the child coughs out or until the child becomes unconscious. If the child becomes unconscious, then follow the basic life support pathway and practice the airway opening and deliver 2 rescue breaths and continue with cardiopulmonary resuscitation. Right? So those are the 2 scenarios that we are going to practice tomorrow. And if you have any question, you can ask.
Sir, is there an age where we can do the Heimlich maneuver, like if they are older children?
I think, as far as the pediatrics is concerned, it's not recommended for any age, but maybe the adults are still practicing that. I'm not very much sure, right? I think adults are practicing that because their chest wall is very much developed and their anatomy is slightly different, so that the abdominal organs are much better protected than in a child to withstand the pressure of Heimlich maneuver. But in children, at any age, up to the age of 18 years, it's not recommended.
Okay, sir.
Sir, the CPR rate of 15 to 2, is that for all children above 1 month of age?
Exactly. Yes, exactly. Yeah, this is the rate. So it's easy to remember. But in NLS, it's 3:1, right? Yeah. So discriminate between these two ratios so that it's easy for you to remember and practice.